Oh,
Okay.
yeah.
Okay.
So, shall I begin?
Yes, please.
Okay, so today I'm going to be discussing about Othmer therapy, which is a form of neurofeedback technique. So the objectives of this presentation will be to talk briefly about the history of neurofeedback. Then we'll be discussing about the introduction, mechanism, indication of the Othmer therapy itself, some benefit and limitation of this therapy, and in the end we'll be summarizing all the things that we have learned. So talking about neurofeedback, so it is a kind of non-invasive technique that will measure the brain activity, the brain waves, using an instrument called electroencephalography. It will measure the brain waves. It will use real-time visual and auditory stimulus or feedback and help the brain to learn to regulate its own activity. The kind of, I think we can compare it to looking at the mirror. So when we basically every morning when we look at the mirror, we can see our appearance. So based on what we want for the particular day, we can adjust our appearance. Uh, and as we are adjusting our appearance, we can also observe the changes that are happening. So as we are observing those changes, we can make further adjustment and so on and so forth. So neurofeedback acts in the similar manner. So in the end, the goal is to help the brain improve its own ability to adapt and regulate its own activity. So talking about the brief history, so it was basically pioneered by Barry Sturman and Joel Luber in 1970s. They used uh, traditional EEG neurofeedback, which uses uh, high frequency waves known as like sensory motor rhythms and beta training. But in 1987, Siegfried and Susan F. Othmer introduced a computerized and real-time version of this neurofeedback. So, talking about their own history, their work is kind of inspired by their own son who was suffering from seizure disorder. So they developed this technique, training the brain of their own son. So, and they dedicated their whole life and career uh, in this field of neuromodulation. In 1998, they introduced the concept of optimal response frequency, and in 2006, they also developed the concept of infra-low frequency neurofeedback. And these two concepts are the foundation of what we call Othmer therapy. We'll be discussing in detail about these concepts. So still the Othmer method is still evolving and growing, and it is basically several studies and trials has been running in EEG Institute, which is based on Los Angeles and several other institutes whole in the whole world. So let's go into the topic proper. So what is Othmer therapy? So Othmer therapy is a kind of neurofeedback which uses infra-low frequency brain waves. And its basic objective is to help brain self-regulate. So the core concept of Othmer therapy is individualized treatment. Individualized treatment as per the person's symptoms, as per the person's disorder diagnosis, uh, and it is also symptom guided rather than diagnosis guided. And another concept is that it uses optimal response frequency, which we'll discuss in another slide. And another major advantage is we can continuously adjust the settings and the frequency of these waves as per the symptom and progress and as per our monitoring and assessment of the patient's profile. So the two major concepts for to understand therapy. One is infra-low frequency neurofeedback. So uh, So in case of traditional EEG technique, which was used in 1970s, uh, they used to use this high frequency waves such as 4 to 40 hertz waves. But Othmer's observed that these waves did improve the symptoms of some patients, but worsen the symptoms of other patient, having the same diagnosis, same profile, and same demographics. They realized that the particular fixed frequency does not help all the patient. So they developed this Othmer method in which they target the oscillation that is below zero point 0.1 Hz, which they called infra-low frequency. So, according to them, the mechanism postulated is this slow brain oscillation are thought to influence the global functional connectivity of the brain. So, the basic internal synapses of the brain, the default mode network, the salience network that we call, they are all uh, regulated by slow brain oscillation. So, in the end, the actual regulation of the brain network, uh, the emotional stability, and the regulation of the circadian rhythm are actually controlled by slow brain oscillation. So, according to the Othmers, we have to target this infra-low frequency rather than the high frequency. So, this mechanism is actually just hypothesized rather than proven. So, current studies are still kind of trying to prove this hypothesis. So another concept used in Othmer therapy is optimal response frequency. So optimal response frequency is individualized frequency for each patient. So at this frequency, when a patient visits us and we use Othmer therapy, at this frequency, the patient experiences greatest clinical benefit with minimal adverse effect. So that is the goal of every clinician, where the patient experiences greatest clinical benefit with low to minimal side effects. So finding optimal response frequency is we can, I think, compare with the analogy of tuning in the FM radio. So when the signal is not adjusted well, it's too high or too low, we cannot hear the sound, right? So in case of brain as well, when it is too high, the symptoms such as anxiety, headache, insomnia, irritability can be observed. When it is too low, fatigue, poor attention, low motivation, low energy can be observed. So according to Othmers, there is a particular optimal response frequency which is individualized to each patient. So I will be having, I have a different optimal response frequency, you'll have a different optimal response frequency. But at our own individual optimal response frequency, we will have symptoms, we will not have these symptoms, and our basic circadian rhythm will be maintained, we'll have better sleep, we'll be calm, focused, and we'll have proper attention. So this optimal response frequency, according to Othmers, will fall within the range of infra-low frequency, which we have to calculate, assess using Othmers method. So based on this two concept, how does Othmer method work? So when a patient is prescribed this method, so EEG electrodes will be placed on the scalp. So the position of these electrodes would differ as per different symptoms, clinical focus. I'll not be discussing this in detail. So when EEG electrodes are placed on the scalp, the machine will record the brain activity, and the computer will extract these infra-low signals. And after extracting these infra-low signals, um, visual or audio feedback will be provided to the patient. So among these infra-low signals, through different sessions, we'll try to measure and assess the optimal response frequency of this patient. So after finding the optimal response frequency of this patient, we will continue the further sessions at the same frequency. So in this way, the brain will adapt automatically to this frequency and will assess those adjustments. These are some the placement of the electrodes. It is different according to different clinical focus. So why was Othmer method used? So some of the indication that has been studied and that shows stronger evidence. are attention deficit hyperactivity disorder, anxiety disorder, seizure disorder, PTSD, depression, and even chronic pain, chronic insomnia. So one thing that we have to remember is it is not a first line, it is not a standalone therapy. It can not be used as replacement or alternative. It can be used as an adjunct to standard medical and psychological treatment. So talking about the duration, how long should we use Othmer method? So it is again individualized as per the symptoms of the patient. It can range from 10 sessions to 100 plus sessions. It can range from 1 to 3 sessions per week, and each session will last from 30 to 45 minutes. So it is really individualized as per the symptoms of the patient. So talking about the benefits of Othmer therapy, one big benefit is it is highly personalized and individualized. It has minimal side effects. Any prior medication is not required for the therapy itself, but the patient should take the standard therapy as per the disorder. And it can really complement and act as an adjunct to these therapies. Along with other disorders that it can help, it can also improve the emotional regulation, attention, circadian rhythm, and sleep of the patient. Talking about its limitation, still high quality evidence, randomized control trials are not sufficient to establish its efficacy. It needs many sessions, and each session is very costly. So many patients uh, may not be able to afford it. So exact mechanism of how it is working, how it works for these symptoms is not fully understood and still under research, and it is still not included in major guidelines uh, in the psychiatric practice as well. So the body of evidence for orthotherapy is growing and is very promising. Few high quality RCTs, but they have very small sample size. Population is very heterogeneous. There is limited guideline recommendations as of now, but I think it is it I think it has a growing and promising um, development that is going to happen in the future, especially in ADHD and seizure disorder. It is showing strongest support and evidence as per Othmer's. So to summarize, so the Othmer method is an individualized electroencephalographic neurofeedback method. It uses real-time computerized feedback. It does not give any electrical stimulation to the patient. We have to remember that. The two hallmark feature is use of infra-low frequency that will extract from the patient brain waves and will assess and adjust the frequency and find and select the optimal response frequency of the patient as per the session, as the each session goes. So it can be used as an adjunct in several disorders such as ADHD, PTSD, anxiety, chronic insomnia, even traumatic brain injury. It has shown great promise in those disorders. I think current evidence is still encouraging and growing, evolving, and a lot of more high quality clinical trials are needed. So these are the references to researches published by the institute itself. Thank you. If you have any questions, I can try to